This mucogingival tissue regeneration instructional case uses a strip gingival autograft and geistlich mucograft to gain keratinized tissue. The goal of this technique is to achieve predictable tissue gain with minimum morbidity and generate long-term, stable, favorable outcomes. Here we see the consequences of a previous bone graft, a mucogingival distortion, loss of the vestibule, and no keratinized tissue. To improve the soft tissue situation, we perform a combination graft utilizing a strip gingival autograft with geistlich mucograft. We begin with a partial thickness flap drawing a horizontal incision parallel to the mucogingival junction. The flap is prepared with 15C and 15 blades, and the mucosa is apically repositioned with respect to its original position. Here we utilize T-mattress sutures to hold the tissue in its new position, revealing the periosteal bed. Then any extra mobile mucosal fibers are removed. Now we harvest a strip gingival autograft from the palate. It has a width of about 2.5 millimeters and a length of several centimeters to connect the most mesial to the distal points. The palatal wound is closed using a 5.0 monocryl suture. Approximation of the wound margins is easy since the strip graft was so thin and favors uneventful healing. The graft is then immediately sutured in place with 6.0 resorbable monofilament sutures. First on the distal end, then cross-mattress sutures are placed to fix and position the length of the strip, and a single suture is used to attach the mesial end of the graft. Here we see the strip graft fixed in its desired position. Now, a geistlich mucograft, trimmed to fit the defect, is sutured onto the periosteal bed, adjacent to the strip gingival autograft with 6.0 sutures. This direct contact is important to allow transfer of keratinized cell signals from the autograft into the collagen matrix. The matrix readily adapts to the bed and is held in place with cross-mattress sutures. Here we are using 6.0 PDS-2 resorbable sutures. Another cross-mattress is added, so 3 cross-mattresses are holding this matrix in place. As you can see here, everything is stable and well adapted to the bed of the host tissue. On the contralateral side, where we did the same surgery a few months ago, we now see a beautiful increase of the vestibule and the keratinized tissue.